Welcome into Your Health. And we have back with us, we are so blessed to have her, Dr. Pam Strickland. Anybody who has ever had to go to her just loves her, and we're so fortunate to have the caliber of health care that we have right here in Montgomery, Alabama. You don't have to go to Birmingham for this. We have it right here. And Dr. Strickland, welcome so much. We talked last time about all the things that we can do to prevent breast cancer. But let's say I go in, and this time I'm not quite so lucky, and I am diagnosed.
Well, usually that process for most women starts with a mammogram, although some women initially notice a lump, and that leads them to get a mammogram. But once there's been something detected on a mammogram, there needs to be some type of a biopsy to find out if it is cancer or not. And that usually means a needle biopsy, where a needle is placed into the tissue and it takes out a small plug about the size of a grain of rice. Usually they take a few plugs, pieces, but then that's sent off to the lab for analysis. And if it comes back that it is a cancer, for most people, the next step is going to be to see a breast surgeon. So my partner, Dr. Holmes, and I are part of UAB. We are at the UAB Breast Health Clinic on Carmichael Road. And most of the patients we see have already had an abnormality that's been biopsied when we see them. But then we make the initial assessment and to determine, is this something that's looks like it's been caught early and surgery is probably the first step in the treatment? Or is it something that because of the particular type of cancer or the stage that maybe they need some other type of treatment first? Specifically either hormonal treatment or chemotherapy. That's not real common, but that happens a little bit more now because we've gotten better at diagnosing these things and have better treatments for some of these things. So if surgery first is going to be the first step, then usually we'll just get the patient scheduled for surgery. Most of the time these things are caught early and we can do a lumpectomy, so it doesn't mean that a woman has to lose her breast just because she's been diagnosed with breast cancer. But we'll make that initial assessment. If it is a situation where she needs to or chooses to have a mastectomy, meaning the whole breast removed, then if that patient is a candidate for reconstruction, we would have her see one of the plastic surgeons from UAB who comes down and works with us down here to do those procedures. And if not, then we just schedule the surgery and we get that taken care of. Once we have the information back from that surgery to know for sure the size of the tumor, making sure that we have clear margins, meaning we don't want the cancer cells to go to the cut edges of the tissue because then there could be cancer cells left behind. So margins are very important. And also where we check the lymph nodes to find out if there is lymph node involvement or not. At that point, they would be referred to see an oncologist.
Okay.
So we do the surgical oncology part of things, and then we would have them see a medical oncologist. And we're so fortunate here in Montgomery. We've got a great set of people here at the Cancer Center, and we've got 2 wonderful breast imaging centers where they focus only on breast imaging. And have top-of-the-line equipment and are really on the leading edge of things. And so back to the oncologist, we would have them see an oncologist who would then make a recommendation as to whether or not they needed to have chemotherapy or something like that. Some women do need to have radiation after their breast surgery, and we've got a great group of radiation oncologists here as well.
Well, I think, when we were talking earlier, like what you're saying is it used to be so drastic. I mean, everybody thought if you have breast cancer, that's a death sentence. Or if you have any kind of like a lump, they just removed all your breast.
Right.
Times have changed.
Times have changed so much. Absolutely, breast cancer is not a death sentence. We have more breast cancer survivors living in the world today than ever before in history because we're better at catching it early and then we're better at how we treat it.
So all in all, I think that what would be your parting words to say to the women and men out in our audience? The main factors you'd like to get across.
Well, the best protection is early detection. In
Absolutely.
other words, getting the screening mammogram and making sure you're paying attention to what's going on with your body. It's not a death sentence. It's very treatable, but it's not a one-size-fits-all. We've gotten so much better at being able to tailor the treatment approach in terms of the surgeries, in terms of whether or not a patient needs other treatment after surgery, so that it's really a lot more complex in our decision making than it used to be. But it allows us to be more focused on treating the individual patient, and that equates to better survival.
Absolutely, because it's tailored to each individual. And I love the fact that I have to say that being under the umbrella of basically of UAB and our Montgomery Cancer Center, all of our Baptist health system, we are very fortunate, and don't feel that you have that added burden of having to go somewhere to have the very best, because we have it right here. And you are an example of having the very best. And thank you so much for being with us.
Well, thank you. Thank you.
And thank you, and I hope this helps your life in every way, and we'll be right back.